Okay, so
I am here.
Good afternoon. I think it's afternoon. Good afternoon, all. Welcome, and particularly good afternoon to the panelists. So this is the Africa Dialogue as part of a global dialogue for INGSA's Global Week of Dialogue. And actually, as part of the African one, there's been the high-level panel broadcast earlier on. For those who haven't seen that before, they can go back and watch it. And even after this one, people can go back and watch this discussion, on the website afterwards. So again, I welcome you. I'm Doyin Odubanjo. I'm Executive Secretary of the Nigerian Academy of Science, and I'm the chair of INGSA in Africa. So my style actually moderating is I don't like to talk. I like to get the panelists talking. So I hope you're in a talking mood this afternoon and you'll really do the talking. However, I'd also been brooding on how we start this. And I kept, juggling my thoughts until I opened the newspapers this morning. And when I did, I saw a news story about the Presidential Task Force on COVID-19 in Nigeria having had a meeting with the Senate yesterday. And some of the comments I thought were just fitting. I found them intriguing because the Senate is meant to represent the people, and I saw comments like being made by the senators, comments like COVID-19 is real, but not potent in Nigeria and many African countries. It's wrong to be swallowing measures used in Europe, America, China, and others. There's something in us Africans that is not in them in Europe and America. In light of this, measures that were put in place were detrimental. Many of the measures were detrimental to the livelihood and well-being of Nigerians and should be avoided, which includes interrupted education and all that, and includes test costs. Now that is becoming an issue, which is about $100 to $150 in Nigeria. And in response, our national coordinator of the task force replied and said the reasons for Nigeria's success were poverty, demography, and aggressiveness against pandemic. There wasn't a lot of details. This was a newspaper report of that encounter, which I found very interesting. And I think that it speaks to some of what we are trying to say and the questions on many people's minds, the evidence for the actions that were being taken and that are still being taken, the decisions, the policies. Where's the evidence coming from? How easy is it to get evidence in this kind of situation, which is an emergency and which is even about something that is largely unknown. It's a new disease. There are socioeconomic challenges, so we're talking about what are we learning about all of these things, including, education that Shaheen probably have a lot to say about. And there are the testing challenges, and at a point we heard about Senegal coming up with a $1 test, which made a lot of news everywhere. Come on, this is going to be the game changer and all of that. So we have all that, and gladly, I'm so glad that we can discuss evidence informed COVID-19 with a distinguished set of panelists today. And I have with me Dr. John Nkengasong, who is Director of African Centers for Disease Control and who had held senior positions at the US CDC before now. I have Professor Aminata Diallo, who is a member of the Academy of Science in Senegal and the French Academy of Pharmacy, who is Executive Director, Partnership for Applied Science, Engineering, and Technology of the World Bank, and Special Advisor to the Minister of Higher Education in Senegal. I have Dr. Shaheen Motala-Timol, and who is Acting Head, Regulatory Affairs and Accreditation Division, Education Commission, Mauritius, and Dr. Karim Aynaoui. I hope I got that right. I've been trying. And he is the President Policy Center for the New South in Morocco. And so it's a pleasure to have you all here. I expect that I'll give you a few minutes to make a few opening remarks, then we can discuss a little bit and take one or two questions, and then I'll again hopefully have time for you to make some closing remarks. So please feel free to comment along the line as you go. Don't wait, just speak up when things are in your mind, or just indicate your hand. I'll know that you have something to say. So thank you very much. Some of the questions on the site and all that, I'm sure you've visited, you've looked at them, you may want to address them now. But just to kick us in with the opening remarks, can I ask John to start off from the Africa CDC? So you have the floor.
Thank you. Thank you so much for the opportunity to invite me as part of the Africa Centers for Disease Control and Prevention to be part of this very important panel discussion. And first of all, greetings from the headquarters of the African Union Commission, the Africa CDC, your organization, which was put in place in 2017. So we are a relatively young organization, just under 4 years, thanks to the vision and the wisdom of our head of states. I think when people talk about the silver lining of a pandemic or an outbreak, Ebola outbreak stimulated and drove the launch of the Africa CDC by our head of states. So back to COVID-19 as a continent, as of today, this morning, the continent has reported about 1.3 million cases of COVID. Of that, 32,000 have died. I really want to pause here and say that when people project numbers of deaths and say it's relatively low compared to the rest of the world, it's very painful. I think one death is very painful. I think I truly don't want us, when I mean us, the collective us, to begin to look at this, transform and seed into our minds that these are all statistics and numbers. These are people, they are loved ones, they are brothers, sisters, relatives that we must mourn every day. So 32,000 people on the continent is a great loss, in addition to the other deaths that are being infringed on us by the TB, HIV, malaria, which cumulatively leads to about 1.2 million deaths a year. It's a lot of deaths for us on the continent. So that's where we are. The Africa CDC has been working hard to exercise its convening ability very early on February 22nd, to be very specific, when the first cases of COVID-19 were reported in Egypt. We convened an emergency meeting of all ministers of health. I remember the Honorable Minister of Health of Nigeria was in Europe and had to detour through Addis Ababa to attend that very important meeting. I think it speaks to what I'm going to project as some of the early lessons that the continent has learned, which is the believability of the continent, that it can take its own future into its hands and respond in a coordinated manner. And I'll come back to that shortly. So we've since supported the continent with over 5 million COVID tests, deployed over 10,000 community workers across the country, across the continent, I beg your pardon, supported many countries with about 250 responders, and we are now distributing a lot of the PPEs that are required. Just to end, to keep my remarks short, because I know this will be a lively discussion. If you ask me the question, what are the main lessons we've learned so far from this pandemic? We are still early on. It's a new virus we are dealing with, but there are 4 main things that are emerging from this already. One is that we are more vulnerable as the global community and as Africa than we thought we were, and especially for our continent. The second is that this pandemic has further exposed the inequalities that exist across Africa and across the world. I mean, that is clear, and we can elaborate on this subsequently. The third lesson is the connectivity, that we are more connected than we thought. I'll just give you an example. When this pandemic was playing out in Asia and Europe and America, we were watching that. We were a little bit fortunate that it was delayed. And all the preparations that we did were targeting East. I mean, we selected those countries that had direct flights between Africa and China, brought them to Senegal, trained them at the Institut Pasteur, and then the second batch in South Africa for diagnostics because we had no labs on the continent that were able to diagnose the virus. But guess where the threat came from? It came from Europe. I mean, all our cases came from Europe. I think so. It was like we were preparing for war, an amphibious assault in the eastern part of the war front, and then it surprised you on the other side. It really showed how connected we were as they were. Very fortunately, we scrambled and then equipped those countries that had no capacity to diagnose them. The last lesson we learned from this is that Africa can coordinate its efforts and can believe in itself if it means to do so. I think it plays to what I've always said, that development is a choice. I think we choose to coordinate our efforts. At the meeting I mentioned in February, all ministers of health agreed that we should have a joint strategic plan that is underpinned by the ability to coordinate, to communicate, to collaborate, and to coordinate our efforts. I think we've since been doing that. We have a continental task force that brings everybody together. Cheikh from Nigeria, Amadou Sall from Senegal, Natalie in South Africa, Barofi in the Min, all of us, all the institutions on the continent come together every 4 p.m. East African time to coordinate our efforts. The last one was yesterday. It brought into to focus the need to strengthen our institutions and the value addition to fighting pandemics if those institutions are supported. A good example is the Nigeria CDC. And Nigeria CDC is a relatively young organization. I think it has been in existence over the last close to less than 5 years, but it has really shown a tremendous leadership. It has become a model for our continent where how a CDC, a mini CDC should operate, or the national public health institutions could operate. You have the Mozambique National Public Health Institute, the Zambia Public Health Institute, the Morocco Pasteur Institute, etc., across the continent, which are stories that we must share. People look at the numbers in Nigeria and say, well, we have what, close to 60,000 cases. But I say it could have been worse. It could have been worse. We've seen how the numbers in India, in Brazil, and other places there. So what makes us believe that without such concerted efforts and leadership and coordination, we wouldn't have been worse. And lastly, the head of states. The commitment of our head of states have been extraordinary. I've had the chance to brief them about 5 times, the Bureau of the Head of States, and they sit there for over 4 hours to listen carefully, debate strategies, endorse them, and they carry that forward. So I think that teaches us that Africa can do it. We just have to believe in ourselves and believe in mobilizing our own assets. Thank you.
Thank you very much, John. I thought that's a good overview of Africa and Africa's response, which is also being said to be quite good and successful. I think we will probably try to get back, to some of those statements you made, including the fact that did Ebola help us? When we're crying about Ebola, did that really help us? So because some of the Asian states are also thought to be good, are doing well because they've had SARS, they've had, the Middle East, they've had MERS, so it looked like they were ready for anything. So anyway, moving on, I think John has a little issue there, but he will join us again. So moving on, I'd like to hear from Aminata in Senegal. Your opening remarks, what do you have on your mind, and how's Senegal playing?
So I want to start by expressing my thanks to INGSA for organizing this meaningful event. I'm pleased to be part of this panel to discuss around the challenges on containing COVID-19 in Africa and building a resilient system in the face of such crises. With the outbreak of COVID-19, countries in Africa have been impacted quite severely due to challenges with particularly health system, connectivity, constraints with ICT infrastructure, and limited preparedness for the transition to online learning and virtual working environment. In Senegal, we realized that ensuring the early diagnostic and isolation of COVID-19 patients, building a robust connectivity and ICT infrastructure are crucial for resilience. The government brings together all actors and offers an excellent platform to facilitate knowledge and sharing and strong collaboration to reinforce the infrastructure and the capacity of healthcare system and teaching and learning institution with the support of partnership. First of all, a world-class infrastructure was quickly set up on March 2020 to produce diagnostic tests, and the first training batch of health workers was done on early April. A wide variety of departments are mobilized to develop outpatient care outside hospital so that people do not all rush to the one location and contaminate one another. Peripheral health facility, health outposts, clinics and centers are also mobilized. Communities, scientists, and the media are closely involved. Concerning communities, we work with a nurse in charge of health outposts and community health officer that we call in our language Bajanugor, who are employed to relay all announcements and information concerning virus prevention and care. In addition, respiratory specialists, including those working in the private system, are deployed to take care of diagnosed patients. We as scientists help public health decision makers understand the virus and conduct operational research on preventive measure and treatment. Challenging as it is, this pandemic is offering many positive opportunities, and people are quickly coming together to provide support and constructing innovative solutions. For example, young Senegalese engineers are creating domestic solutions that are not expensive, and hand sanitizer, hand washing equipment, reusable masks. These responses are providing us with important lessons that can be documented, shared, and provide further opportunity for learning, research action, and transformation. Globally, Senegal is doing its best to contain the pandemic, but we do not yet know what will be the exact outcomes of this multidimensional pandemic in the long run. But it is already clear that people's lives are being impacted by the disease, from the trauma of loss of loved ones, from loss of income, and from lack of social proximity and security. It is worsening poverty, political and social tension across the African sub-region, and inequalities between urban and rural areas, between social groups, and between men and women. The existing inequalities and poor living conditions are the comorbidities that may later accelerate the spread of the coronavirus among African population. This in turn has global implications, since COVID-19 has a global impact for sustainable development and progress towards sustainable development goals is compromised. What happens in Africa ultimately affects our global progress and vice versa. We look forward to further discussion on this issue and welcome ideas for debate and collaboration within the INGSA Forum. So, Mr. President.
Thank you, Aminata. Yeah. I hope we really do get time to discuss all of these issues. Particularly, I think it's good you've also raised the issues of social issues. Have we considered some of those things, and what role have the social sciences played, on the continent, in terms of research, understanding some of the measures and the decisions and policies being made? How do they affect, or should they be different in Africa, like the lockdowns, for instance, and some people held earlier on that you shouldn't do that in Africa. At least most parts of Africa, it's not right, it's not practicable. So there are things to really raise, and I hope we get there after everyone has their opening remarks. Okay, so Shaheen, can we get yours? Opening thoughts, opening comments?
Sure. I would like first to thank very much INGSA for giving me this opportunity to participate in this dialogue. I think it is important that we are coming together from different parts of the world to discuss this event. And in Mauritius, we are sitting in a very different position right now as compared to many other countries, as we are presently not under lockdown and we are COVID safe. We do have some citizens coming back from abroad with the virus, but they are being isolated and tested by the health services. So I think that there are key issues that have led to policy decisions during that time. So contextual factors about country influence the way that policies are made, and the approaches that we have taken also are very important. Mauritius is a very small country. We are an island. We are geographically quite isolated. The size of the population is 1.3 million. We have access to basic needs like clean water, electricity. We also have access to communication facilities and internet access. We have high internet penetration. We also have free health services. So all these contribute to the way that we make policy in Mauritius. And I have to say, when the pandemic started, it took some time to come to our shore. And if we had closed our borders earlier, for instance, early February, we would have prevented the virus from coming to Mauritius. Unfortunately, by the end of March, we had our first case of the coronavirus. We had, during that period, 10 deaths and 350 something cases. But by closing the borders and ensuring that everyone who is coming in is isolated, quarantined, and tested, then I think that we help to contain the spread. And this was something that is very important. During all that time, we ensure that very strict measures were taken. For instance, we had very strict lockdown at the start of the pandemic in Mauritius because there was a period of uncertainty, I would say, about this virus. What is it? How does it transmit to other people? And we had very strict lockdown. And having this kind of strict lockdown without a rationale behind it, sometimes you might fear that this could lead to social insecurity also, because you are not able to go outside, to go to the shops, for instance. And we have to also be aware that when we are taking policy decision, it is impacting the human. You see, so how do we ensure that human rights are being protected, that everyone has access to food, for instance? And this is where the community in Mauritius pitched in and started to help others, you know, by giving away food packages, etc. And by then, I think that was in April, the government, with all these data that it had in place, they started to think about a COVID fund. How to help people who are not able to have to work, for instance, because some people, they work to feed themselves on a daily basis. They don't have a monthly salary. So we need to look into all these issues at the government level. And this is something that is important, that governments are able to take decision in a timely manner on the basis of information that they are receiving. This is a very different situation. We were not prepared for that. The world was not prepared. But what was important for us is that we learn from lessons that were being implemented in other countries, for instance, in China, in Italy, where we learned that there need to be sanitary measures to be put in place, and there should be very strict social distancing. And by taking into consideration all these lessons that we were learning, we implemented that here in Mauritius, and we managed by the end of May to really contain the virus, so that at present we don't have anyone who is local cases of COVID. And we also took really care to support the population. There were some decisions that were taken, for example, removing tax on masks, etc., so that you could also buy them cheaper on the market. So it is important, I think, in such situation that you have a government that believes in science and that will be using evidence to take decision. Of course, sometimes when there is an urgency, when there is an emergency, then you might not take the right decision, but at least you are understanding and reaching out. For example, for the World Health Organization, we had technical committees with the World Health Organization to support us throughout our decision-making process. And this was also very important in how we address this situation and what type of approaches we decided to use at that time. And right now, we are going to open borders again. So we are just worried how this is going to work out, because we understand that a second wave is very possible. And it would really have a huge impact, not only on the economy, but also on the health of the population. So as a country that depends very much on tourism, we close our borders, and this has impacted our economy. And people have lost their jobs also. But we also have to think, should we sacrifice the economy for the health of the population? It's a balance that we have to think about. And I think this is a hard and tough job for a government to undertake in this period. And this is a global crisis, so it impacts everywhere the same. Even though we don't have COVID cases right now, we still impacted very negatively by what is happening in the world. We do not live in a bubble. We don't live in isolation.
I mean, thanks so much, Shaheen, for those comments. I thought you raised something we would like to discuss later, which is, do our governments, believe in science and the necessity for science? Because when you talk about science advice, oftentimes you're looking at the fact that, I mean, at least from my experience, many countries, Nigeria to start with, and many other countries, you are trying to get the government to demand for the science. So you're trying to create the demand for the science advice while also trying to generate the science advice at the same time. And I mean, unlike countries where the government itself is the one asking for the science and the science advice, so I think that's a good point to discuss. But just a clarification, especially because of dependence on tourism. I thought it was easy to cut everybody out since you're an island. You can cut everybody away easily. However, as you try to reopen because of the economy, and then you talk about testing people and all that, do they have to pay for that, or that's free on arrival?
I mean, up to now, it's mostly our citizens that are coming back. So they are being quarantined, for example, in hotels that have been transformed into quarantine center, and they are tested. But as at date, it is free for everyone that is coming in. But in October, when we are going to open, even for example, local people who are not residents in Mauritius, there might be a fee that is applicable. This is still under discussion. For instance, for those who are non-residents, but who stay in Mauritius, that fee might apply to them. And people are reluctant, to come to Mauritius as tourists for a period of 3 weeks and then to have to undergo quarantine for 2 weeks. So the purpose then is lost for them. So these are hard decisions to be taking as a government, because if you put yourself in their shoes, do they want to risk the health of the population? But at the same time, how are we going to survive this pandemic? How, as a country, we depend so much on the external factors, and we don't produce that much. So our economy is very much dependent on other global issues. It has to be really taken into consideration how we are going to go forward now.
Yeah, so we'll hopefully get back to it, which is how do you make those kind of hard decisions, between the economy and, the science, what you know to do. What do you do now? But then we have to take Karim's comments, opening comments, and we're really running out of time already. So Karim, you have the floor.
Oh,
and I already see some questions being put up. So
let me be brief.
Will come with questions.
Let me be brief since we are running out of time. I have two comments. The first one, just to tell you what Morocco has done. As colleagues before, they've described the reactions of their countries, so it's quite similar. It was taken very seriously with very strong commitment, the highest level of the state, and with also, I would say, some creativity and originality in terms of almost ex nihilo in some cases, creating industries and producing masks and similar tools, ventilators, so on and so forth, to respond to the crisis. I think Africa has responded to the crisis with pride. You remember in the press, Africa was questioned, there would be another catastrophe in Africa, etc. And I think all the countries have sort of, responded to the crisis with lots of pride and efficiency and getting together, with the strong social homogeneity everywhere. I think there was a sense of community in every country to raise to the challenge. So Morocco has done, confinement, using hotels, being very rigorous on flights, controlling, testing people. I think was a first-class response, I would say. Of course, we have been hit very hard by the economic recession that was, sort of engineered by the response, like everywhere. So we estimate that we've lost 3 percentage points of GDP every month, basically. So you do the math, it's about, 9 percentage points of GDP compared to a sort of a baseline scenario, all thing, that has been lost during the 3 months that have during which the confinement have lasted. But we have published a lot on that, so I invite your auditors to read the papers that we have on our paper. Let me focus on the second point, which I think could be a bit more of interest for our discussion, which is the nexus between decision-making, academia, and science in real time. And I think this has been a challenging issue all around the world. We have academics where the rhythm of their work and the necessity, the constraint of, serious academic work, fact-based, evidence-based, science, basically. It takes time, and the need to respond very quickly, in real time. And everybody turned to the scientists and said, tell us, what is COVID, what do you know, etc. In the end, we don't know much, basically. You remember all the discussions, etc. And I think France was a particular case in point where there was a very heightened debate between using such drugs and others. And there was a sort of global debate about that. I don't think we know much. We know a little bit more, but we don't know much. But it tells a lot, and it's not only about the medical science, it's also about social sciences, about the impact on the economy, it's about also the psychological consequences for individuals. It's a whole nexus. And I think there are lots of lessons to be drawn about, how do we embed, how do we articulate science and decision-making and policy making, and both have their own constraint. And I think this is where we come in institutions like the one where I work, where this is our role in a way to intermediate between academia and decision making. How do I make sure that I take first best, or if not second best decisions in real time, and how I have a constant interaction with the, evidence, facts, science, and how I update, permanently that with the very strong linkage with decision makers, of course, without bypassing, the parliament and democratic institution. The question is not to have, a science sort of driven way of governing public affairs, but it's really how, you make sure all the time you study the best option. And it's a very complex chain, and it's a value chain that is very complex to put in place. And there are very interesting lessons to be drawn from this crisis in terms of risk management, in terms of, taking the best of our scientists, etc. So I can elaborate a bit more, but this is really for us a topic that we've taken with passion here at our think tank, and we've tried to contribute the best as we could on these issues, while being very conscious of the difficulty and the novelty of the situation. And it's maybe an opportunity in a way to reconcile in some countries, or to deepen, to reinforce the linkage between science in general and decision-making and public policies in particular. And how do you, and the third pillar would be what I would say, how do you involve populations in the decision-making, and you have a constant feedback loop in all those components of society for taking the best decision in the interest of your population. A last point, and I will conclude here, is of course international cooperation at the African, the continental level. I think the African Union has played an interesting role during this crisis, but there was also very interesting partnership and collaboration between Morocco and many countries in Africa. I think this is very important. So we should seize this opportunity to sort of build response mechanism, collaboration, partnerships, which is between science, decision making at every country's level, but also at the continental level. And I think some of the colleagues have mentioned interesting initiatives in this area. Many thanks.
Right. So thank you, Karim. If I may just take you off in terms of discussion. So what would you say, could have been done better, in your opinion, coming from the Policy Center for the New South? Is there something, maybe just one example of something you think could have been done better? That given the chance again.
As modest and fragile human beings, we can always, at our individual level, but also as institutions, countries, we can always do better. So this is a principle of a permanent, right, striving permanently to do better. I think one area where we've discovered that we should have done better in the past is in Morocco, for instance. At some point, we decided. It was decided by His Majesty to build in a cash transfers for affected poor households in Morocco, for compensating for their job losses and of closing of businesses, so on and so forth. And we discovered that we didn't have a national registry of all the poor households, very well identified, where you could target, money transfers of cash with your bank account, etc. It's a project that was in the pipeline in Morocco for about 20 years, but for many reasons, it never completely delivered. There were some pilot experience here and there, but suddenly we are here we need to transfer to support all those households. What do you do? And I think there was a very interesting reaction. And in the end, we were able to transfer the money to the government, and there were many solutions using the telecom and using telephones, etc. And we were able to transfer, but it was a bit painful because the system was not in place. So now things have been shaping up and accelerating, and we are sort of moving toward the national, unique registry of individuals where we have informations about their income levels, etc., to be able to activate this kind of, social safety nets. So that's a very concrete example where we were not sufficiently prepared, but the crisis has been a sort of wake-up call, and was, useful in terms of, doing the right reform, in a way, accelerating the reform and making sure we implement it, although it was, as I said, something that was in discussion for about 20 years, I have to say, to be honest, since the early 2000s.
Yeah. I can tell you we had the same problems here. And a lot of questions and controversies generated by cash transfers and palliatives.
No, it's
being
like
given up.
car insurance.
Yeah.
No, it's like car insurance. You don't want to pay your car insurance, but you're happy to have a car insurance when you have an accident. So, you know, so you better, I think this is the same kind of mental dynamics that are at play here. And I think the crisis, in a way, is useful, you know, how sad it can, but it has some benefits if you have the proper reaction and you use this as an opportunity to reform and to make progress.
Right. I hope John is still there, you know, because he did mention something about this coordination across the continent, which Karim also talked about, this coordination. You know, it's important, it helps, or it did help, and it is helping. But the question, I'm not sure he's there, I want to be sure he's there. There's a question
I'm
now
here.
from the floor. Fantastic, thank you very much. So there's a question on the floor that this meetings you have on a daily basis, you said on a daily basis with the CDCs and ministries of health and things to coordinate and share, you know, what's going on. That how do you feed this work effectively into the government, you know, and their response and their policy making? Because if you are talking to the Nigeria CDC, for instance, you are in a meeting, you've discussed things. How effective is the communication and, you know, into the government itself, decision making?
No,
how has that worked out?
Can you hear me?
Yes, we can.
No, absolutely. I think that this is our coordination is continent-wide. I think you have people who represent different sectors of the government and private sector and academia. And we expect that Nigeria CDC, just to use Nigeria as an example, that Nigeria CDC is part of the Ministry of Health, and that discussions will feed into the ministries of health. I think that is one. The second thing we do is that we do policy briefs through the official diplomatic channels at the African Union and vet that through the various missions here, the different country missions at the AU, and that information is also vetted to the countries. The third channel is through the Africa CDC governing board, which is made of ministers of health from across the region. And lastly, through a coordinating platform that was put in place by the head of states for the ministers of health to and the RECs and the regions to all come together once every 2 weeks to coordinate and discuss policy issues and also approve some of the work that is done at the technical level. So they have different layers of and mechanisms and platforms that offer themselves to at least direct that information right to the way it ought to be.
Right, and while we're at that, because Shaheen mentioned something, and I mean, Shaheen and Aminata will also comment on that probably, but she did mention something that Mauritius basically was tapping from the WHO, you know, and following whatever was said from there. So the question for me would be that how much of locally generated evidence do you feel, I mean, as the Africa CDC was coming from the continent, how much research, for instance, was going on? Or did you find it easy to get evidence locally that could be used apart from, you know, things from WHO and other international partners?
No, we do generate our own primary evidence and data as an African CDC. Of course, we share with WHO, but we try to make sure that the data and evidence is African generated and owned and led. For instance, every week we do invite a member state to present to this coordinating meeting that I indicated, the task force, which was endorsed anyway by the ministers of health, called AFCOT, the African Task Force for COVID-19. Like yesterday, Chad presented, Nigeria has presented, Morocco, and many other countries, South Africa, and lessons are drawn from there. And especially, we should always remember that we are only, 6 to 7 months into this pandemic for Africa, because our pandemic actually really started in March, the first week of March. So we've benefited from countries sharing data, information on both the clinical spectrum of the virus. Like, give you an example, we weren't sure what the virus would do, the interaction between COVID-19 and HIV and TB. Okay, then South Africa came with data, the first available data to show that the risk where that HIV and TB pose was not as great as those posed by other underlying diseases, i.e. diabetes, hypertension, and others. I think that was our greatest fear and greatest concern, because we all know that what HIV does, HIV, TB, and including malaria, they all stimulate the immune system. It leads to hyperactivation of the immune system. Both your CD38 cells, the HLA, RDs are all activated, and that may actually offer itself to a very appropriate conditions immunologically for COVID virus to excel and to create even what you call hyperactive activities that will lead to further damage to the immune system. So, but that hasn't been the case. I think that is those are very good examples of locally generated data. Second is really the asymptomatic nature of Africa. And I think even before the world started talking about the asymptomatic nature, because of the interaction that we've had every week with different national public health institutions, we were able to begin to quantify what the amount of the level of asymptomatic nature of this virus would be for the continent, which was at that time when we started quantifying it, it was around 75% to 80%. So of that, I mean, Uganda came out with very strong evidence during one of our presentations to show that a vast majority of, and Kenya as well, a vast majority of people that were infected were asymptomatic. I think we have since confirmed that with in our own setting, where 5 of our own staff within the Africa CDC were infected, and they were all asymptomatic. They only knew they were infected because they were about to do their COVID test to travel. And then it was revealed that they were infected, and then we asked them to stay home and for 10 days, repeat the test. They did that, and they've all been cleared. They are back at work. So I think we're generating data and evidence as we move forward. Lastly is the lockdown. If we look at the evidence, the epidemiologic evidence in several countries, we take South Africa, for example. If South Africa hadn't locked down, it was going to be seeing an increase of 50% of new cases daily. Okay, and when they locked down, where they had about 700 cases, and that really helped them. That 2 weeks later, when we tracked that situation, South Africa was having about 5% of increase in new cases. So I think the lockdown, you can see how drastic and important it was for them to blunt this. Today, we say South Africa has 600,000 or some cases, but it could have been worse, as I said, for Nigeria. I think that we've been using our own evidence locally, but we coordinate. The WHO Afro Director General and I are talking on regular basis, and they are also part of the Afro, part of the coordinating body. Remember, the task force is the continental-wide task force, which was set by endorsed by the head of state. So, in summary, we do look at our own data as strictly from an African perspective, but we also triangulate and that data with what WHO is producing. And I think so far we have been so much aligned.
Right. So, I mean, I'm keeping my eye on the time, but honestly, there's so many things to ask you, and maybe I want to really drain everything before I move, again to Aminata or Shaheen. And, when you say lockdown, vis-a-vis, some people say there's going to be a longer term pandemic of economic challenges that all of those things are going to give to us, but that's not where I'm going now. There's a question from the floor that says, from your comment earlier, for instance, when you talked about Ebola, specifically again, you actually mentioned one or two things, but specifically again, how would you say that helped Africa? And you have one or two particular success stories, apart from some of these things you've told us, but you think you want to highlight from the continent.
So let me
engage.
So let me respond briefly in two ways. One is that the experience of Ebola and HIV has been incredibly helpful in some parts of the continent. Like in West Africa, if you look at Liberia, Sierra Leone, and Guinea, that just, I would say, recently graduated from an Ebola outbreak. They were very capable to deploy community healthcare workers to support the testing. Remember, we don't have a vaccine, nor a treatment, drugs for this. So we're all relying on public health tools, which is you test, you trace, and you treat, so isolate. So they have been using this extensively, I mean, very much effectively, I would say, to fight this pandemic. I think that is one lesson learned from Ebola. If you look at HIV, I mean, South Africa's success story has been the ability to also do aggressive testing, backed up by mobilizing a large number of community healthcare workers, about 30,000 of those. And that is also being informed by what the work they have been doing in the area of HIV/AIDS, which is really characterized like community ownership, community leadership, and community engagement, using the community to respond in a very sophisticated manner. I think that is very clear. Lastly is that there's a silver lining for us in Africa with respect to this. I think there are three things that always bring a pandemic under control. One is, do you have the diagnostics? Second is, do you have the treatment? If you can diagnose people, can you treat them? And lastly is, do you have the vaccine? So if you have any of those missing, one of those missing in the equation, it becomes, that disease becomes difficult to eliminate. HIV is an example. We have treatment for HIV, you have diagnostics, but no vaccine. So we've lived with that virus for 40 years now. And significant progress in the area of treatment that is there with us. Malaria. I mean, since most of us were children, we've been having malaria all our lives, but there's effective diagnostic, very good treatment. If you sleep under a mosquito net, you are safe, but there's no vaccine. So it's there with us. I mean, TB, a vaccine is available, not very effective. So I think what I'm saying is that as a continent, we should do what I call, begin to fill what I describe always as the known do-nothing gaps. Those are the gaps that we know for health security of the continent, which we have invested very little. Before this pandemic hit, there was no laboratory or no company or no diagnostic capacity made in Africa. But now we have 5 countries that are developing diagnostics and for COVID, and which I'm hoping that will build on that platform to begin to develop diagnostics for HIV. It is mind-boggling that for the past 40 years, we have been testing Africans for HIV. I think we are a continent that do conduct most testing for HIV. We conduct about 150 million HIV tests a year, but there's absolutely no one diagnostic, HIV diagnostic test produced in Africa. We want to see made in Africa diagnostics. So the efforts that are being conducted in Nigeria for diagnostics, in Senegal, in Morocco, in Ethiopia now has just partnered with China to begin to produce up to 15 to 20 million COVID tests starting this September. And I believe South Africa are very credible efforts that spin up from this pandemic. So I think I'm really looking forward with a lot of optimism that we should really focus on those 3 areas and have local manufacturing in the areas of diagnostics, vaccines, and treatment.
Right. But you seem, though, to have left out the community, trust, public trust in government, community engagement. But taking it up, let me ask Aminata, because talking about diagnostics, I think the Institut Pasteur, if I'm right, in Dakar is quite notable. And there was a lot of talk about this cheap test coming up, out of Senegal. And then somewhere along the line, we stopped hearing about it. So I don't know what happened to that. And maybe you want to also address some of the other issues raised, because sadly, I'm running out of time here.
I think I have already said that we understand very early that we need diagnostic, we need treatment, as he said, we need vaccine. So Senegal had set up a platform on March. Don't forget that the epidemic started in Asia, Europe. So we have time really to react. And the first thing we did is to set up a platform for diagnostic. And I think something was very, very important is science diplomacy. It was very, very important and helpful for us because we have the experience of Korea. We have the experience of China. We have great relation with them. And en March, we set up this platform in collaboration with this very strong partner. The lesson I can learn from this is really the partnership in science is very, very important. And unfortunately, it's not very developed in Africa. We develop economic diplomacy, political diplomacy, no science diplomacy. And this is really very, very important. And I think now about the test, if you want to speak specifically about the test, I think we are ready. We already produce 10,000 tests, diagnostic, and I think in next month, we will be able to produce 1 million tests for Senegal, but also for our partners in Africa. And we have a very disruptive economic model. So we can explain why now, just to have access to this platform, some countries pay for the access. And the payment of this allow us to really take in charge the cost for developing this test. And this economic model is very, very disruptive. And I think Africa must learn on the economic model to set up this kind of platform. And I think next month, we will be really, we are now doing what quality, performance, and so on with an English institution. And after that, I think we can really send the diagnostic across Africa. And I think it's a good news for Africa to really have this diagnostic test who are really very strong, performant, and very, very cheap. And we must learn on this model, I think.
Great. Unfortunately, I mean, the 1 hour is up, so I'll begin to, wind this down. It's interesting you mentioned science diplomacy. For us, we had some involvement of the Chinese, but that caused a lot of backlash in the country, and people said, no, we don't want. There were some Chinese health workers who came in, and everybody revolted and said, no, we don't want them here. I
think it's a mistake. We must be open, and right. We must be open to all countries. We must learn from all countries, from Mauritius, from China, from Korea. We must be really open. I think so. If we start saying we don't want to work with China, we don't want to work with France, I think it's a mistake. I think it's a mistake. These questions are global questions, and we need global answers. Even we can have specific strategy, but the problem is global. So no country can solve the problem if you're isolated. We must collaborate. And I think that if I have one message to deliver is, please, let's be open. We're African, but let's be open. Let's work with all people who can bring science or technology to Africa, so we can capitalize on that and go forward. It's my message.
Thank you. I assume that's your closing remarks for us. Thank you very much, Aminata. So, Shaheen, you have some closing remarks you want to make. Since you have, you want to put out in a minute, you know.
Yeah, I think I agree with Professor Aminata's closing remark that we should be collaborating more at different levels. For instance, I work in higher education and we have a lot of students from Africa who came to Mauritius to do their higher education here in different institutions. And I think this is something that we need to encourage, that we need to support, whether financially or, you know, academically. And not just at the level of undergraduate program, but mostly at postgraduate level, where each country we have our own, I would say, context, our own resources, and we have different ideas that we need to put together to try to solve some of our local problems, and then we go to the continental problems and then global problems. We do have very high level students here who most of the time they go out to Europe, to the USA to study. So it would be an opportunity, as Dr. Karim said, to innovate right now, to see how can we support our higher education institution, our research center, how can we provide them with what they need to go to another level, you see, to stop reacting, but really, you know, to active, more proactive in trying to identify what are the needs and what are the gaps that exist in the continent. And it is something that so many people have been talking about in Africa for such a long time. And this is really the opportunity that we should take, you know, to really make that concrete. And that would be my closing remark. That is, let us work together as a continent, and this is the chance, opportunity through this pandemic, you know, to come together and find solution that will benefit us all and also the world.
Okay, great. Thank you very much, Shaheen. Actually, I'm passionate about the education side of these things. And I wish we had more time to discuss some of those things and the challenges of trying to do online education without infrastructure and resources in many places, but we don't have the time. So I think I'll only be able to take Karim again to give us a brief closing remark, something you still want to say in a minute.
Thank you. Thank you very much. I will, you know, concur with my colleagues about the partnership, the necessity of permanent dialogue and exchange of experience, and being open to the rest of the world. My second message would be about, and it's also in line with colleagues. It's really the nexus that I mentioned earlier on, and the complex value chain of science and public policy. Making that includes, of course, academia and training, and how you have a virtuous circle between all those dimensions with a permanent feedback loop of you know, learning and experimenting and acting, and that goes through, of course, an important role for academic institutions and research institutes linked with public policy making. So I think this is quite complex. Some countries are doing this very well. Some others, you know, need to improve, and that's not easy. And of course, while also involving population. So I think you know, we should continue to work and share experience in that spirit to try to improve that nexus and it's the way it functions. Thank you.
Thank you very much. Thank you, Karim. So unfortunately, that's the end. We have to stop now. And I want to thank Shaheen. I want to thank Aminata, John, and Karim. It's really been nice, you know, talking to you. And left to me, I would double the time, you know, but it's not left to me, unfortunately. I want to thank all the people who joined in And you all can go on the website and join the remaining activities for the week and watch past broadcasts as well at any time. So again, that's it from me. Thank you very, very much. It's been nice hearing from you all. Thank you.
Thanks, yeah, thank you.
Thank you.